I'm Dr. Kumar Vel. Tomorrow, 29th September, being the World Heart Day, I would like to say a few things to the public, mainly the role of healthy diet in hypertension and control of hypertension. It's an interesting thing. Actually, we should know what is a healthy diet. Healthy diet is normally the routine follow-up is a DASH diet and Mediterranean diet. DASH diet is nothing but it involves food diary, that is, you have to maintain a diary for food, and 1 teaspoon, that is 2,300 milligram of salt per day, and you have to avoid canned and processed food, junk and fast food. That means the packaged food and processed food should be avoided. There should be a decrease in alcohol intake, and in fact, you have to decrease tea and coffee as well. Because the caffeine contains more of a salt intake, so may decrease it to 2 cups of coffee per day, and potassium, intake of potassium, magnesium, and fiber decreases the blood pressure. Okay, so you have to consume more of a fruits, vegetables, nuts, and seeds. Fruits and vegetables contains more of potassium, while nuts and seeds contains, they are a main source of magnesium. And DASH diet is nothing but a dietary approach to stop hypertension. Actually, it's an eating plan which is rich in fruits, vegetables, whole grains, fish, poultry, nuts, legumes, and low-fat dairy. Foods low in salt, cholesterol, and saturated fats are high in potassium. So this DASH diet is very important. And the Mediterranean diet is the same as the DASH diet, but it has generally higher in fat, preferably monosaturated fat from olive oil, nuts, and seeds. DASH diet gives 2,000 calories per day. It decreases triglyceride in blood and increases the HDL. It is a high density lipoprotein. It's a good cholesterol as such. It should be increased and increased by DASH diet. And the bad cholesterol, that is LDL, is being decreased by DASH diet. Now let us come to this hypertension. Hypertension, normal blood pressure is, what is hypertension actually? The blood pressure is nothing but blood is forced against the pressure, and the pressure walls of the inner walls of the vessels causing high pressure. And normal blood pressure is 120 by 80 millimeter of mercury. Anything more than that, say 140 by 90, let us take as a target. If the systolic blood pressure is increasing by 140 and diastolic blood pressure is increasing by 90, we should be cautious. So you have to keep the blood pressure under control by following healthy diet plan. Suppose if you don't follow, you have to face the consequences like heart attack, which we call as a myocardial infarction, and stroke involving the brain. So mainly these two. Other small things are there, but this mainly stroke and heart attack is the main problem with the increased blood pressure. And what else to be done to control blood pressure? Apart from healthy diet, you should follow, you should have daily exercise. Exercise can be a fast walk or running or jogging or swimming or aerobic exercise. Walking at least for 45 minutes a day per day is very important to control blood pressure. You have to sweat out, in fact. And next thing is, apart from exercise and healthy plan, you should have this bad habits of smoking should avoid, alcohol intake should be avoided. What I will suggest to my patients, there are 5 yes, that is very important, which plays a role in everybody's life. There is one yes is sugar, second yes is salt, third yes is stress, fourth yes is smoke, fifth yes is sedentary habits. That is dull habits. I mean, you're not no walking all the time, sitting in the easy chair, sitting in the chair, reading books, no movement like a clerical life. So 5 years plays an important role in everybody's life. If you control these 5 years, your life will be superb. Like, let's take salt, that is a blood pressure. Increase salt intake, increase the blood pressure. Number 2, sugar. Increase sugar, this is your result in diabetes. 3, stress. Stress is very important because if you have a stress, there is increased blood pressure to the target area and get into problem. So stress, how do you avoid stress? You avoid by doing yoga, meditation and all. 4th is smoke. This can be avoided. 5th is sedentary habit. Sedentary habit means dull habit. There is monotonous work. There is no active work. That should be changed. Like in an office, a peon moves faster, but a clerk won't move faster. A manager won't move faster. You should use only stairs and no lift. Most of the time, you try to walk, reduce going by lift. That's very important. Out of these 5, you can avoid smoke, you can avoid sedentary habits, you can even reduce stress. But time and again, I'm telling you, the salt and sugar mainly comes from the genetic side. You can only control, you cannot stop its arrival. So, as far as possible, try to reduce the salt intake and sugar intake and maintain a good, healthy life by diet control and exercise. And last important thing is medicine. If your physician says take medicines for blood pressure, you should take. No, you should not have a second thought about not taking. And once is the blood pressure, lifelong blood pressure only, unless you completely avoid salt in the food, which is not at all possible by any human being in the present circumstances, where all the children are taking junk foods and fast foods. So, my request is have a wonderful life by doing regular exercise, taking healthy food, avoiding all the bloody bad habits like smoking, alcohol, and all, and enjoy your life, especially during this Corona period, where there is a lockdown on and off, and there's a plenty of chances for eating at home. Eat a healthy food. Thank you.